Views and opinions expressed on the show by the host and doctor experts do not reflect the views of
Okay,
Johnson& and
in
Johnson
10
or
seconds.
its management.
Okay.
Viewer discretion is advised.
Okay, Kat, you're live.
Hello, everyone. Thank you so much for joining us here tonight. My name is Kat Salaw, and I am going to be your host for the first ever session of Johnson's School of Gentle. Now, I know that the past weeks have been very confusing and challenging for all of us. The situation is new and unexpected, and there's really a lot of feelings going around. There's fear, there's anxiety, and there's confusion about everything, most especially for new and pregnant moms. Having a newborn and going through pregnancy, they already have their beautiful moments, as well as a list of difficulties too. And the situation is really not contributing to something that will make it go a little bit easier for our mommies out there. That's why today, Johnson's Baby has invited an expert to help ease all your worries and answer your questions about how to protect our pregnant moms and their newborns in this time of COVID-19. Now, this is a J&J initiated Facebook Live, and our doctor for today is the J&J hired resource speaker to discuss topics related to what we have tonight. And we are honored to have with us a member of the Philippine Pediatric Society, the past president of the Perinatal Association of the Philippines, the past president of the Philippine Society of Newborn Medicine, and a current professor at the University of the East Ramon Magsaysay Memorial Medical Center, Department of Pediatrics. Allow me to introduce neonatologist Dr. Joey B. Salazar. Hi, Doc.
Hi, Kat. Good evening. And
evening,
I'd like
Doc.
to say hello to the viewers as well. Likewise, I'd like to congratulate J&J for this timely and relevant educational forum, and thank you for having me. Well, Kat, allow me first to say a bit about what you've initially said as your introduction. And I'd like to quote a statement from the WHO saying that because of the present crisis, that we stay at home if you feel well. If you have fever, okay, or cough or difficulty breathing, then you have to seek medical attention. And we need to follow the instruction of our local health authority. Having said that, Cats, what is going to be in store for our viewers tonight?
Well, Doc, thank you so much for, of course, being with us and giving us your time, because a lot of our mommies and daddies and families out there are really very worried with the current situation and how they can go on, dealing with this beautiful pregnancy or this wonderful newborn that they have. So today I have a couple of questions submitted to us by moms. And of course, Doc Salazar, Doc Joey, he will be addressing all these questions for all of us. And then later on, we're also going to be going through some of the comments that our Facebook viewers will be able to ask in the comment section. So you guys make sure that you keep commenting any questions about pregnancy or childbirth that you have, and share this Facebook Live as well with your friends so that maybe they can also have their worries eased and have some advice from Doc Joey. All right, Doc Joey, would you like to start?
Yes, please.
Okay, let's do this. So let's first start with maybe the number one concern of pregnant moms today, which is, of course, going out of the house and going to the hospitals. We have a bunch of questions about that right now. So our first question, safe po bang pumunta sa OB at magpa-check up ngayon?
Ay nako, napakaganda ng tanong, Cats. No, dear viewers, we know that pregnancy and birth conditions, okay, will continue even during the time of crisis, no. But the one big question that we probably will hear from our mothers to be would be pregnancy during the corona crisis, no. And I'm sure that a lot of the healthcare providers, no, the first thing that they will tell them would be not to panic. Why? Because prevention of the spread of the virus should be the top priority. And if you are well at the moment and you don't have any medical complications in the present or past pregnancies, then you need to discuss your antenatal plan with your healthcare provider. But given the situation, how probably will one do that? Then the that future mom should not go to the hospital or any health facility without prior notification with her healthcare provider. So there should also be no support or accompanying person should she decide to go an outpatient that both of them agreed on, unless it is an integral part of the patient care. So the healthy pregnant woman will have fewer face-to-face visits with their healthcare provider. And because of that, Cats, there's going to be more contact through the telephone, online, which we now refer to as your telehealth or your telemedicine. For example, what we do have at UERM is the SiriusMD.com. So it becomes an opportunity for the mothers, okay, to get in touch with their healthcare providers regarding particular issues. So given that question, okay, my point is, okay, our safety is the priority. So we have to resort to lesser face-to-face interaction and more of telephone or what we probably refer to as your online consultation, Cats.
And of course, these consultations and over the phone, they're also as effective because if you really have a relationship with your doctor or your healthcare provider, that would be enough.
That is correct.
Okay. Of course, safety is always number one. But Doc, what about, this one is from a mommy naman na 35 weeks pregnant na po siya. Okay lang po ba na weekly or walang weekly check-up para sa 35 weeks pregnant?
Napaka-pertinent ng question, no? Kasi syempre, you're excited and you're all after not only the health of the mom but as well as the health of the future baby. So yung recommendation ng Philippine Obstetrical and Gynecological Society as well as the Philippine Society of Maternal and Fetal Medicine is to schedule through telehealth, through telephone, through online, the interim consultation. And they have specified the 16th week, the 24th week, and the 34th week of gestation. Aside from taking note of these critical times, though, the patient should also be taught how to care for herself. They would be encouraged how to take their blood pressure, make use of their glucometer, and more importantly, they need to make sure that there's fetal movement every 2 hours. And that assures the mother, okay, that patient would have a good fetal well-being. Kung walang problema tulad ng pagdudugo, pagsakit ng tiyan at presyon, well, hindi naman niya kailangan magpunta sa ospital. Hindi naman niya kahit na siya ay 35 weeks na. Nagiging kung high risk siya at siya ay dinudugo, sumasakit ang tiyan, mataas ang presyon, mataas ang blood pressure, then that patient would still need na makipag-ugnayan sa kanyang healthcare provider again through telehealth. So again, they came up with a guidelines, okay, maximizing, okay, minimal contact as well as instructing the patient what to do regarding those periods of pregnancy. So that is very important, Cass.
Always check with your healthcare provider as well. And I mean, it is an emergency situation, so it has to be a very emergency situation as well for you to be able to go to the hospital and have yourself checked. And what about, Doc, if a new mom who just gave birth? This is our next question. If may newborn siya and of course they're both very vulnerable, safe po bang magpa-follow up check-up ang mommy and newborn?
Again, no, it's a good question. Kasi remember, pag babae ka, manganganak ka, sinasabi niya, yung isang paa mo nakalagay na sa hukay, which is true. And therefore, you really need very good assessment by your healthcare provider. So if it's going to be an uncomplicated pregnancy, the follow-up would usually be after 1 week. So kung wala naman problema at maganda ang discharge instructions sa kanya ng kanyang healthcare provider, talking about the obstetrician, then, okay, they can just communicate through telephone or online. But the other issue would be the baby. Ano naman, kamusta naman, papaano naman ang gagawin? So for the pediatrician on our side, we do as well give very good instructions, and we have to give our telephone and our web and our access, internet access to the patients, ang more important issue with regards to follow up would be the immunization. Kasi at birth, okay, they are given the BCG and the hepatitis B. What about the succeeding immunization schedule? So according to the Philippine Infection Disease Society of the Philippines, the follow-up recommended schedule administration of vaccine will have to be followed as what is in the childhood immunization schedule. But should the risk of the current circumstances outweigh the benefits of immunization, temporarily delaying vaccination is going to be something that will have to be considered. And therefore, we need, and the pediatrician and the mom will have to do a catch-up schedule. Now, allow me to say more about the immunization cats.
Yes,
Vaccines usually, if they are not given on time because of the situation now, the next dose should be given in the earliest scheduled visit. So remember, if a healthcare provider or the pediatrician is going to be affiliated in a hospital that takes care of PUI or your PUM, your persons under investigation or persons under monitoring, then it doesn't become that safe for the baby. So what's going to be done now? So vaccine doses should not be given, okay, at interval less than the recommended dose. And that will have to be noted by the mother, okay, and the pediatrician. So the catch-up growth will have to be planned. Now, if there is a facility that the patient is going to be close to and they do not care for PUIs or PUM, then we refer the patient. We need to refer the patient to them because we are afraid of the vaccine preventable diseases. And we don't want to have another epidemic such as measles, no? And that will have to be the way it is going to be done. There are combination vaccines, there are simultaneous administration of vaccines, and if this is going to be done, that is going to be beneficial for the patient. So again, it has a very good question that is going to be of concern to both the mother and the baby, especially so for vaccine preventable diseases.
Of course, we still have to, again, you've said that we have to follow the schedule, but of course, this still has to be an active and very personal conversation with their doctor because, we really are unsure of the situation right now. But it doesn't mean that we have to completely, at least doc, yung mga moms out there, yung worry nila about the vaccines and the skipping, it eases them a little bit, I hope.
Yes, and let's pray that we're over with the crisis so that we can resume what's supposed to be given to the babies.
Mm-hmm. Let's just call it a little hump, a little challenge
yes,
when it comes to.
Yes, it is. It actually had put the whole world into a standstill.
Mm-mm. But of course, we still have to try and, ease our worries. And another question that we have is coming from, I think, really one of the top concerns as well of pregnant moms is, saan po sila manganganak, Doc?
Alam mo, problema talaga, no? Naalala ko tuloy nung ako'y medical student pa, no? On my 4th year, nagpaanak ako sa bahay. So I had to go. I was called. We were called. We have to attend to the patient, and she was already in imminent delivery. So we delivered. But how safe probably would it be, no, if it's not going to be in a health facility? Then we now talk of the birth plans, no? So the healthcare provider, the obstetrician, maybe the midwife, no, will have to discuss birth plans with the mother, especially so during this crisis. Number one, dapat nakahanda na yung gamit niya, yung dapat nagagamitin ng bata, yung mga lampin, yung lahat na kailangan gamitin, ipack na yan sa isang bag. So should the time come, okay, andun na, bit na lang. Secondly, the mom should discuss birth plans with the healthcare provider. And last is going to be the most important one. She should be able to identify the nearest hospital. Why should she have to give birth in a hospital? Of course, getting the virus will always be a concern. But again, okay, it would always be safer in terms of preventing complications, okay, of the mom and of the baby. It decreases morbidity and mortality if she delivers in a health facility. What if it's a COVID hospital that's going to be just close by the place? They can still be admitted, okay, and I'm sure that they will be attended to. But important thing there is what? The right and proper care for the baby will have to be given. Of course, there will be instances when inanganak sa bahay. We recently just admitted a patient na pinanganak sa tricycle. So again, these situations are unexpected, okay? And the option is the nearest hospital if it's not going to be feasible to deliver where her obstetrician or healthcare provider is going to be affiliated with CATS.
Thank you so much, Doc. I think that kind of calms a little the moms down because, of course, the doctors like you out there are really out there to protect our pregnant moms and the newborns as well in this time of COVID.
Yes.
Now, in COVID-19 naman, Doc, we have a question or we have a couple of questions naman regarding the risk of getting COVID at this time. So our first question is, are pregnant women at higher risk of getting COVID-19?
You have a very good view. Your questions are really something that will help them be comfortable with the situation at least. So getting the correct information is very important in meeting this challenge, as what you said. No, so alam mo, Katz, the Department of Health has recognized that the pregnant population would belong to a vulnerable group. There are evidence that have so far shown that the pregnant moms are still no more likely to contract COVID-19 infection than the general population. And I would like to cite again what the WHO has reported. There are a lot, or still research is currently underway to understand the impact of COVID-19 infection on pregnant women. And data are limited, but at present, there are no evidence that they are at a higher risk, referring to the pregnant moms, of severe illness than the general population. But it is as well important to teach them to protect themselves, to report possible symptoms such as fever, cough, difficulty of breathing to their healthcare provider. So it means that cats, it's just going to be the same risk as of the general population, but there are quite changes, okay, in the system, in the immune system, in the body of a pregnant mom, okay, that puts them at a very vulnerable situation.
There you have it, mommies. So if you are worried or if you have been worried that your risk is higher because you are pregnant right now or even trying, there you have it straight from Doc. We are not, or they are not at higher risk. However, of course, the changes in the immune system really does. You just have to basically monitor yourself a little bit more. Okay, so at least that worry is out of there.
Well said, Kat. It's well said.
Thank
Very
you.
good.
So, Doc, question number 2. Ito na po. Kapag nag-positive po ba ang buntis sa COVID-19, how will this affect the baby?
Yan, no? Diyan nagkakagulo tayong lahat because unlike in the other countries, no, they have dedicated just an health facility for pregnant moms, no? So, alam na nila. So again, I would like to cite what the WHO is saying. We're all new to this. This is something, as you said, not expected. So there's very little experience, and we learn from the experiences of the other countries. The WHO states that we still do not know if a pregnant woman, okay, with COVID-19 can pass the virus to her fetus or baby during pregnancy or delivery. But if you look at the news, okay, you will hear of babies who are going to be having their screening for COVID to be positive. So, but we still need to know more. And to date, the virus has not been found in samples of amniotic fluid or breast milk. At least that is what I know as of this time. So again, okay, that it probably will now say that, a mom in imminent delivery in pediatrics, okay, in the Philippine Society of Newborn Medicine, together with the Philippine Pediatric Society, would classify the baby as either going to be stable or unstable, depending on the maternal history.
Okay, thank you so much, Doc. At least that clears it a little bit because, of course, there is that fear talaga.
Yeah, sometimes, Katz, I'm sorry, sometimes they think that can it lead to miscarriages, okay,
yes,
or birth abnormalities. As of this time, no, there is no association or causation that has been documented yet.
There you go. And alam ko, Doc, positive thinking and feeling good about yourself at the time of pregnancy is really important.
Yeah,
Okay,
correct.
at least that removes that worry a little bit. Now, Doc, let's go to mothers who need to breastfeed at this time of
Right,
COVID-19. So,
right.
can a COVID-19 infected mother breastfeed her baby?
Yes. No. Now we have to qualify whether it's a PUI or a PUM. No. So remember, what we are afraid here of would be transmission. Okay, of the virus. And therefore, okay, if it's going to be a stable imminent delivery PUI mom, PUM mom, what is going to be done? So there are recommendations from other countries. They would say separation muna yan. But the mom is encouraged to breastfeed if she wants to. Only that you need to advise her to do the necessary respiratory precautions. So talagang nakamask yan kasi ayaw mo yan kasi droplet yung transmission. So the baby might get it, okay, when she sneezes, when she talks, okay, and she's not well protected. So she can breastfeed because we know that breast milk, okay, is going to be the optimal nutrition for babies. Only there should be precautions, okay? And if that baby is going to be roomed in, that baby is not going to be with the mom. So there's at least going to be a 3 feet distance, okay, between the baby and the mom. And then, of course, they will have to be screened and tested. There's going to be separation until the time, though, that the mom, okay, turns negative or the baby turns negative in the screening for COVID-19.
So breastfeeding is a yes. But of course, I think the precautions naman in breastfeeding, you really just have to be extra careful. But
Yeah.
it's still very, very important
Okay.
over the virus, I believe.
Right, right.
So, Doc, how do I keep myself and my baby protected and safe during this time?
Ito yan, Kat, it's not just for pregnant moms. That will hold true
Mhm.
for you and for me as well. No, we always would have to cite, okay, the WHO because we use this as the standard for care. No, so number one, washing your hands, okay, frequently. So at least for 20 seconds. So you sing happy birthday while washing your hands, no, with soap and water because the virus has a lining covering of fats, no. So when you use soap and water, it destroys that covering. And then another alternative would be your alcohol-based hand rub, and then that is going to be very effective as well. Of course, they will have to keep space between yourself and that person beside you. The distance is at least 1 meter or 3 feet, which we call as your social distancing, no? And we need to avoid crowded places, and that's why we are in a lockdown. We also, you cats will have to avoid touching your men.
Oh,
And that is, you cannot touch your mouth, your nose, and your eyes. O mali, your mouth, your eyes, and your nose. Okay?
oh
And of course,
no.
respiratory hygiene. When you sneeze, you flex your elbow, and this is where you cough. And in that way, though, okay, what happens? It sorts of blocks, okay, that the your droplets, no, and thus you are not able to you won't be able to be transmitting people beside you. And of course, the use of tissue paper, use it and you dispose it properly. So again, those are very important factors, not only for a pregnant mom, okay, but as well as for everybody. And very important really would be the lockdown now, no, that we are experiencing, and we hope that it really slows down transmission of the virus.
Doc, super important talaga yung blocking of the
Yeah.
cough and of
Oo.
the sneeze.
You will be surprised, my pediatric patients, okay, the toddlers, when they cough in the clinic, naku, the respiratory hygiene is very good talaga. They're
I think
very
we forget it when we grow older. We
pwede,
forget.
no? Pwede.
But
Oo.
Doc, I like that. I will take charge that I cannot touch my men. Of course, the mouth, the eyes, and the nose. No
Correct,
touching of men.
correct,
So if you're
correct.
tuned in, keep that in mind. Doc Joey says no touching of men, mouth, eyes, and nose. Okay, Doc. So I have a couple of questions, naman, that has to do with the do's and don'ts during pregnancy. So the first question is, can I continue to breastfeed while I am pregnant?
Oo nga. So that's quite a tickling question, no? Kasi papanganak mo pa lang, okay, eto, buntis ka na naman. Parang, so what happened? So sometimes mothers forget now that during lactation, may tinatawag na lactation amenorrhea. So nagbe-breastfeeding sila, nadidelay yung period to a certain time, and then after that though, pwede na. But if the question is, pwede bang mag-breastfeed during if the mom is pregnant? Of course, yes, no? The baby will carry on making that milk while she's pregnant, and she'll be able to breastfeed, okay? So while she's breastfeeding the toddler, okay, or that baby that she has, no, the unborn baby will still get all the needed nutrients from her when she gives birth. But of course, she needs to attend to the following as well. Number one, she needs to make sure that she's eating well. Number two, she needs to keep taking her daily folic acid supplement. Well, maybe you probably will, or some of our viewers will think, teka muna, yung oxytocin is present during pregnancy and that cause contraction. Kung ako ba buntis at nagbe-breastfeeding, ano mangyayari doon? So what actually is noted in the literature is that there is no evidence that it would trigger contraction during breastfeeding, okay, when you're pregnant. However, okay, the experts would say to be cautious when you're expecting twins, when there's previous miscarriage, or prematurity in the past birth. Those are just going to be some of the conditions, okay, that they would say, o teka, hinay-hinay muna. But otherwise, if she's pregnant, no contraindication. Go ahead, breastfeed. The
There you
baby,
go.
the baby.
I think also being aware of what's going on in your body is very important, especially when all these changes are happening. So, Doc, you mentioned folic acid supplements.
Yeah.
So, what else po ba yung mga best vitamins para sa mga buntis?
Okay. Again, no, talagang yung mga nanay
Parang
mo,
mahabang
talagang
listahan niya.
Parang gusto nila medyo mahaba-haba ng usapan to. Actually, the bottom line with regards to your question, Kat, is what? Is this: what you eat during pregnancy will affect your energy as well as your well-being. So therefore, it would also directly affect the health and the development of the baby. So it is important that the mom-to-be chooses nutrient-dense, healthy foods, okay? So definitely she's going to gain weight, but gaining weight during pregnancy is normal. But what is important is she gains weight in a healthy way. So let me talk about a bit of the food groups that probably she can look into a review. So pregnant mothers viewing. So this is what you probably should take note of in your diet. Your dairy products are going to give extra calcium and extra protein. This is going to be a good source for your phosphorus, your vitamin B, your magnesium, and your zinc. Well, these are just going to be one of the sources that she can look into. Second would be putting legumes in the diet. Your legumes would be an excellent source of your plant-based fiber, protein, iron, and folate, as well as calcium. Madami tayong kamote. So sweet potatoes is going to be another good source. Why? Because it is a source for your beta carotene. And why is beta carotene important? When converted in the mother's body system, it is converted to your vitamin A, and it is needed for growth of the baby. The next food group would be the fish. No? An example here would be salmon. Naku, napakamahal naman. Paano ba yan? So any seafoods, okay, would be rich in what we call as your omega-3 fatty acid. Why would this be important? It's important for brain development as well as eye development of the growing child inside the mother's womb. So it is recommended that at least 2 to 3 meals per week will be sufficient to provide your omega-3 fatty acid. We do not stop with the fish. We continue with providing eggs, no? And we know that your egg would contain a little bit of almost every nutrient. Kompleto na siya. So another important nutrient there would be your choline. And choline, again, is going to be important for neurodevelopment. What else? Your dark leafy vegetables. These are going to be good sources for fiber, vitamin C, vitamin K, vitamin A, calcium, iron, folate, and your potassium. Do not forget your beef, your pork, your chicken, the lean meat. Okay, these are going to be good sources for iron, again, choline, and other B vitamins. Not to forget your fruits. Do you eat fruits in the morning? Because this is
Yes,
going to
Doc.
be a good source for water, vitamin C, and fiber. Your whole grains is going to be a good source for fiber. And of course, water. A pregnant mom, okay, is recommended to take in 1.5 to 2 liters per day. But the general rule is you drink water when you're thirsty and you drink until you have quenched your thirst. So not too much, meaning to say that you drink what's just going to be an appropriate amount for you.
Mm-hmm. Yes, I know that sometimes.
Natandaan kaya, I hope.
But Doc, it's okay. You mentioned a lot of eating involved in this, of course. So I think that a lot of moms are very happy out there because it's their excuse.
Walang junk food na sinabi ha. Walang
Yes,
junk food.
as long as it's the right food.
Lahat na yun.
As long as it's the right food to eat. Now, Doc, and actually all the mothers out there, we hope that you're still commenting in the Facebook Live because we'll still be asking Doc Joey for a lot of questions. But this one, we have brought it up because, of course, the mental health of a mother is also very important at this time. So, Doc Joey, how can pregnant moms handle anxiety or take good care of their mental health during this time?
Mental health, no, that's something that is really going to be affecting not only the pregnant moms but all age group. No, again, we have all heard about a mom getting pregnant and she becomes insecure. No, but we have to know what that insecurity, the source of that insecurity is. She delivers birth. Okay, she delivers her baby after birth. Again, there's some source of insecurity. So I would advise that number one, we have to ask or collect what worries her. Why are you worried, mommy? Is it because you're pregnant? Is it because your husband is working in the hospital that you know he is going to be sick? Or is it because safety? Or is it because food availability? So once that we probably have asked her about her worries and we need to break down and identify which of these worries are going to have a solution. So pag sinabi niya, natatakot kasi ako kasi buntis ako, saan ako manganganak? Then we have to explain to her, ito ang situation, ito ang magagawa natin. Yung asawa ko, nagtatrabaho sa ospital, ayaw papasukin ng barangay. Then we have to, discuss with her na yung safety yan, ito yung mga issue, ito yung mga ganyan. So foremost would be educating the mother. And once they are educated, then it eases, those anxieties. However, there are non-anxiety measures that could be done. What are these? You have to advise them to choose what to watch or what to read. Fake news is going to be one source of anxiety. So therefore, there should be accurate information that she is going to be getting from whatever she's reading. What's another thing? Spiritual relief through prayers. No, magiging madasalin tayo ngayon. And that is going to help, reduce that anxiety or at least eliminate maybe. And the last would be encourage her to meet with good friends, get out of the house, not now, after the lockdown, and probably she can engage herself in singing, dancing, or writing. So all these activities and strategies mentioned could help lessen anxiety of moms, also as well as maybe the postpartum depression that they will go through. Not all of them, but some go through to a certain extent.
It still has to involve enjoying life and enjoying life with their baby.
Correct.
No matter what the situation is right now. And we know that it's very, very difficult for moms out there, especially if there's so many challenges that we're very confused with. And so we're really thankful that Doc Joey here is enlightening us and answering our questions. Hopefully, we can help you a little bit more because we have a few more questions. Ito naman, Doc, it's about bagong panganak. Ayan. So our first question is, ano po ba yung mga dapat na ginagawa sa baby pagkapanganak o yung mga tinatawag nila na essential newborn care?
Ang galing mo doon, ha, Kats? Yung tinatawag na essential newborn care, 4 ang prinsipyo noon. So mula nang pinanganak siya, you dry the baby immediately to prevent hypothermia, and then you do your skin-to-skin contact, delayed cutting of the cord, okay, umbilical cord, and then skin-to-skin contact and breastfeeding. So pagkalabas niya ng delivery room, the other concern is now going to be breastfeeding. At alam naman natin na ang breast milk ay ang ideal na pagkain ng mga sanggol. At ito ay napatunayan sa mga lahat ng pagsusuri ng WHO, ng DOH, PPS, PSNBM, etc. No? At pati ang POGS na rin, the Philippine Society of OBGYN. Bakit breast milk? Kasi ang breast milk ay may kargang nutrient na magpapalusog sa kanilang mga sanggol at mayroong mga antibodies na magbibigay ng proteksyon para sa sanggol. Hindi lang naman ang sanggol ang nagbe-benefit dito, Kats. You know that a breastfeeding mom will decrease her probability or the incidence of her having breast CA or ovarian cancer. But of course, okay, ang mga paalala natin para mapangalagaan niya na mas mabuti yung kanyang anak would be yung balanced na diet. Kung may support group, pwedeng nanay, tatay, lola, mga pasyente sa ospital that will support breastfeeding, that is going to be good. But what is going to be more important is yung madalas ng pagpapasuso ng baby niya. Bakit? Kasi pag nagpapasuso siya, yung sucking itself, no, will already command and tell the brain, kailangan ko ng gatas, mag-produce ka ng gatas. But the important thing there is, mas madalas yung pagpapasuso ng nanay, sa kanyang anak.
And we know, Doc, that breastfeeding is really such a precious and important bonding moment for a newborn and its mother. But Doc, in this time of social distancing and, kailangan ba mag-self-quarantine ng mga mothers ng 2 weeks kapag nagpanganak sila sa hospital? What do they have to do in terms of breastfeeding and social distancing and quarantine?
Ang kainaman, Kats, ngayon, no? So bali very very stringent ang history taking, no? Meron ka bang kaubo, sipon, lagnat, may history ka ba ng travel, saan ka ba nang galing? So from there though, you are able to qualify whether kung may simptomas ka, that will be person under investigation. Kung ikaw naman ay walang may contact ka, then that becomes a person under monitoring. So pwedeng mag-breastfeeding, pwede niyang i-express ang gatas niya. Kasi nga, sabi ng WHO, it doesn't cross the breast milk. So we know that, in fact, yung breast milk I would classify as the first immunization, lalo na yung presence ng colostrum. So napaka-importante. But we go back to what initially we have discussed earlier, which is going to be the safety, safeguards, of how probably we do it. Hygiene, okay, is going to be important. Precautions is going to be important. And again, if this is a stable newborn, okay, she can, the mom wishes to breastfeed, she can. Either express breast milk, okay, room in with the 3 feet, okay, distance between them, okay, or preferably if there's somebody though who will be able to help, okay, who doesn't have the infection, then that's going to be very helpful for the mom. Just take the necessary precautions.
And Doc, when it comes to, I know you answered this question already earlier, but when moms need to vaccinate, just in case, we have mothers that just joined us right now and have this question. A lot of moms, they also asked us kasi if it's okay to delay the vaccines for babies since it's not safe to go out. So, Doc, could you answer that question? And how long po ba can we delay it?
Yung how long is medyo mahirap, no? Kasi ang sinasabi natin would be depende sa sitwasyon. So, ang inaano natin, ang recommendation ng PDSP is, okay, go ahead with the scheduled immunization if that's going to be possible. But we have to weigh the benefits versus the odds or the circumstances. If it increase the risk of that patient getting infected with the virus, then we do not advise that. And therefore, we need to plan our catch-up growth. So when is going to be the second vaccine that will have to be given? So at birth, we said the child is going to get your hepatitis B and your BCG. So next dose ng hepatitis, first dose ng DPT, kailan ibibigay? So it can be given at the soonest possible scheduled time. So kung kunyari yung affiliation ng doktor, okay, is in a PUI, PUM center, then they can look for a health facility that doesn't take care of your PUI and PUM, and therefore it would be safe, no? It would be made, the chances that it's going to be safe is going to be high, and then we refer the patient so that the scheduled immunization can be given.
There we go. Of course, the safety of our newborns. Our talaga, Doc. I'm preparing na.
All right. Okay.
Yes. So the safety of the newborns and the moms are really the concern right now. Most especially, it's because if you can't really reach your doctors immediately, at least you know that, it's really important to be able to call them or ask them online, email them, have that relationship so it's safe. Now, Doc, we have questions about breastfeeding pa. Most especially, making sure that you have enough milk. We know that a lot of mothers have this problem. So, ano po ba yung pwede nilang gawin para may sapat na gatas for breastfeeding?
Okay. So yung sapat na gatas, meaning to say, ang number one really, sa initial niyan, ang mangyayari is walang breast milk pa na makukuha yung baby niya. No? Wala. Kung meron, kukunti. Pero makakaroon siya, may experience niya na habang tumatagal, nararamdaman niya na yung engorgement, mabigat na yung breast niya, no, kailangan niyang i-express yung gatas para lumabas at the same time, ma-stimulate yung production ng milk niya. So, may mga galactogenic na substances, no, na pwedeng ibigay tulad ng malunggay, no? So, yung malunggay, eating the right food, okay? And all this can be a stimulus to, or an added stimulus to the production of the milk. But number one really would be the good connection between the baby and the mom. So there should be yung pagpapasuso siya, dapat is talagang bigyan ng effort. Kasi yun lang ang mag-stimulate, no, ng more production sa nanay.
But of course, Doc, when it comes to the breast milk, I know a lot of mothers also feel anxiety about that,
Yes.
About them being able to to breastfeed rather.
Yes, oo. Kaya importante yung support group, no? So may importante yung may encouragement kasi hindi naman siya madali sa simula, lalo na kung bago ka, no? You're going through a period of adjustment. But these moms, okay, even before they give birth, are already advised by their obstetricians na magbe-breastfeed ka ha, kasi ito ang benefits na makukuha ng anak mo kung ikaw ay magbe-breastfeeding. So yung eagerness na ituloy niya yan at yung difficulty will be surpassed depending on, again, as what you said, the relationship between the doctor and the mom and the support group, no, that will be pushing her. Sige, kaya mo yan, tuloy mo yan, walang problema yan, kaya natin yan. So,
yes, all the breastfeeding moms out there, kaya nyo yan. We salute you all. Hopefully that this is still a beautiful experience for you, regardless of the situation that we're in. Now, Doc, our next question is from a woman naman, or from a mommy na in-advise na siya na hindi na mag-breastfeed. So, ang sabi po niya is, I still breastfeed my baby kahit in-advise na po na hindi. Is that safe?
Tigas ulo, no? Tigas ng ulo ng nanay. Well, medyo yung question is medyo mahirap sagutin kasi hindi natin alam yung mga circumstances, no, why she was advised, no, not to breastfeed, no. So hindi natin alam, but I could probably cite some reasons kung bakit hindi nakakapag-breastfeeding yung mommy kahit na gusto niya. But there are milk banks, no, that are going to be that are existing in Metro Manila. Kaya lang, of course, ang priority nun would be the high-risk babies na yung mga prematures. So, yung kung bakit hindi siya pwede mag-breastfeed o magpasuso, dapat malaman natin yung dahilan. Nagki-chemotherapy ba siya? Siya ba ay isang open case ng tuberculosis? Natukhang ba siya? Drug addict ba siya? Lasinggera ba? Kasi yung alcohol, if there's too much consumption, okay, it stocks in the fats of the breast. And that becomes now something that probably can be transferred to the baby as well. At yung huli would be HIV. But I congratulate the mom for her persistence, no, in giving that precious fluid. But for this particular question, no, I'm just limited to probably saying that these are going to be some of the contraindications to breastfeed. But of course, we need to know what exactly the problem is.
Right, Doc. The act of breastfeeding with a skin to skin contact, that has so many benefits for mothers and newborns.
Yes.
Yeah. So perhaps I think that because baka Doc talagang gusto niya talaga niya na hawak-hawak niya lagi yung baby niya in that situation.
Alam mo, Kat, may tinatawag kami na kangaroo mother care, no? Pero yung kangaroo mother care is being done for the smaller babies, yung mga full term. Pwede man na rin nasabihin na kangaroo mother care, pero ang mas nagbe-benefit would be yung mga low birth weight, yung tinatawag namin na maliliit, yung mga preemies, kulang sa timbang. Why do we do that? Because we empower the mother to be able to take care of their babies. At yung tulad ng sinabi mo, yung skin-to-skin contact there, no? Yung pagmasahe at masahe mo dun sa anak mo habang nandyan sa'yo. Ibig sabihin, nandyan yan sa loob mo. Kung pwedeng 24/7, 24/7, nandyan yan. So, and studies have shown that yes, it increases the rate for breastfeeding as well as, okay, maintaining temperature and increasing the weight of the baby as well. It's not the mom lang ang pwedeng mag-kangaroo mother care. So yung daddy, no, kung yan meron dyan damo sa kanyang dibdib. So that serves as an insulator. Or even the other can be a surrogate to KMC. But definitely the mom, okay, kung kaya niya at low birth weight yung anak niya, the better.
It's so important to have that. I think that touch, that sense of feeling and of care. It's just so beautiful when it comes to, I mean, as adults, Doc, we all love hugs.
Yes.
We all love affection. And so
Yes.
much
But
more
social distancing, you cannot do that with cats.
Yes, Doc. Yes, Doc. More important lang po for the baby and the mother. So, Doc, any advice for moms naman? What can they do after giving birth to a newborn in this special time that we have?
Okay, no, parang siguro it brings us back to nung unang panahon, no, nung hindi pa masyadong komplikado ang lahat, no. So what do we tell the mothers, no? So the mother should eat more and they should make sure that they're eating healthier food. She should be able to rest and sleep well. The healthcare provider, the obstetrician, the pediatrician will have to discuss breastfeeding with her as well as breast care. We also have to give her pointers with regards to the home environment. Why would this even be important? So that home environment will help promote health of the baby as well as for leading to the faster recovery of the mom. So the room should be well ventilated. And of course, we teach them about the danger signs. Ano ba ang dapat natin tandaan regarding the baby kung kailan siya kailangan dalhin sa ospital? Tulad ng excessive crying, nagdadiarrhea, lumalaki yung tiyan, hindi nagdidigha, hindi dumudumi. And when we have already, and in fact, for the high risk patients, we even teach them how to do basic life support. So these things, okay, we need to empower them, no, so that they're going to be better equipped when they home, especially so during this time. We give our phone numbers so that they're able to call us when there would be issues that will have to be resolved. So part of it though would be discussing with them, okay, routine care, and bathing is going to be important, no? Bathing, what should be noted, temperature, what is going to be noted, dapat normal. Dapat alam nila kung ano yung baby product na gagamitin, no? That is going to be one that is going to be gentle, okay? And that would be good for the infant skin. The other thing that I would like, and I was even part of this study though when I was a fellow together with Dr. Sifra to empower the steward, okay, when they did the infant massage, no. So when we talk about infant massage, we know that this is going to be the gentle stroking of the baby's body with the use of a gentle soothing lotion. And in fact, no, it is one of the strategies, no, for babies who have high risk for atopic diseases, no? The use of emollient, the use of your gentle soothing lotion. And it is said that, we are now talking about yung microbiota na tinatawag is not just in the GIT. Yung microbiota is going to be your good and bad organism. And we have to protect that healthy microbiota of the child. And it is said, though, but if you use this as early as the 3rd week of life, okay, up to I think the 4th or the 6th month, it decreases incidence of atopy. So that massage as well would serve as an avenue for the parent to bind with their little ones. Again, there are studies that have been reported in the Journal of Pediatrics that say that infant massage helps in reducing crying as well as colicky. It relieves stress. When your baby's stressed, you can feel that, no? So what does stress do? You relax the muscle. So what is the effect of the massage? It releases your oxytocin, okay? And this is your feel-good neurohormone. And at the same time, it would decrease cortisol, which is going to be high when the child is going to be stressed. And of course, it was known to be improving your motor skills. It also helps the baby sleep better. Sleep is going to be important because has something to do with the development or strengthening of the immune response. Okay? So they say that if the massage is just going to be given before bedtime, it increases your melatonin production. And we all know that your melatonin is a sleep regulatory hormone. And that's one good point. Aside from that, cats, it would improve blood circulation. There will be a decreased level of discomfort that is caused by gas or acidity. And again, it is a way to deal with postnatal depression, the mental health of the mom. There are studies that have shown that it would improve the behavior of the mom when she gives massage to her baby. It is an effective way to deal with the depression of the mom. And lastly, it boosts psychological and social development. And I would like to cite again another report or study that was published in the Asian Nurses Research Journal.
So vulnerable. That's why it really takes a lot of special care to show the babies, and you have to be extra gentle to these little precious things. And that's why it's really important to choose not just how you spend time with them, but the products that you expose your babies to as well, that are designed, of course, for newborn sensitive skin.
Cats, you don't need me. You are able to actually, expound on all these issues that the questions the moms have been sending you.
Thank you. I'm practicing, Doc. Joke lang. But of course, I just want...
Not now.
Yeah, of course.
After the crisis.
Yes, and I very much look up to all the moms out there. It's such a crazy adventure to have a newborn and to bring someone forth to life and to care for someone and show it love so much. But of course, it's so challenging in this time of COVID, most especially if, we just have to be extra careful, but still be able to show these babies or our babies some love, some skin to skin touch that will feel or make them feel a little bit more special in this time. And, of course, when it comes to the gentlest products, Johnson's Cotton Touch Baby Wash and Lotion, which I think will be perfect for the infant massage, Doc, that you were talking about.
Yes.
Yeah, it's perfect because, of course, this is Johnson's best hypoallergenic care for specifically newborn sensitive skin. And, the Cotton Touch specifically, it's day one pa lang, you can use it already. That's how gentle the Johnson's Cotton Touch is. Formulated for sensitive skin. And of course, ultra light, ultra gentle, perfect for all the things that you told us, Doc, today.
Well said, Katz.
Thanks, Doc. Wait, Doc, I hope you have a little bit more time because I believe that we have a couple of questions from our viewers who are also very concerned. Can I start with the Q&A that's going to come from our Facebook?
I just forgot to mention the father will have a role with regards to breastfeeding as well, no? It's not that ang role nila is maglaban ng lampin, no? So during breastfeeding, okay, they should be massaging the mother's back.
Ooh.
Yes, okay. So that is going to be the role of the dads as well, and it helps more, okay, in breastfeeding.
Okay, so daddies, if you are tuned in, or maybe, you know, siblings, if you want to help mommy, diba, be a little bit more calm around this time, that's exactly what you can do. So, Doc, we have a few questions right now. We still have a little bit of time, I believe.
Okay.
Okay, so here we go. The first question that came from our Facebook group, do pregnant women with suspected or confirmed COVID-19 need to give birth by cesarean section?
Well, again, okay, if it could be delayed, no, and there is no really urgent indication for that cesarean section, then that's going to be the answer, no. But there are going to be indications wherein, okay, it has to be done because there's a obstetrical indication. But what would be more important there would be what are the healthcare providers equipped? So they should have their personal protective equipment. So if it's going to be an elective cesarean, definitely no. But if there has been indication, then we have there's no way but, to deliver the child by an operative technique. More importantly, that COVID team, okay, that will take care of the child should be protected as well.
Okay, Doc, thank you. So our next question is coming from a mom who is asking, how will the mom know if her baby is doing fine kung wala pong ultrasound?
Okay. Yung kamukha ng sinabi natin earlier on, okay, yung fetal movement. So, hawakan niya yung tiyan niya, sumipa ba, gumalaw ba, okay? I mean, meaning to say that given the situation now, ano yung best na pwede mong gawin sa ngayon? Wala kang ibang simptomas, hindi ka nag-bleed, hindi sumasakit yung tiyan mo. But every time you feel your abdomen, you drink something cold, mararamdaman mo, lumilikot yung baby mo. And I know, I was told by the obstetricians, okay, that dapat, no, you also remind your mommies na dapat gumagalaw yung baby niya at least every 2 hours, may movement siya. And that will assure you na okay ang baby niya at that particular level. So, dun importante ngayon yung pinag-usapan natin with regards to telemedicine or telehealth, no? Kung may mapansin siya, ngayon magalaw, pero kahapon magalaw, pero ngayon hindi. Bakit kaya? So, yun, naglalagnat ako. Bakit kaya? So then that would be a good opportunity for her to get in touch with, again, not personally, but through the phone, okay, or through online ways.
Siguro, Doc, it's very important also for mom if yung i-write down talaga niya yung mga situations niya every day, no?
Talagang handa ka na, ha? Talagang tama yun. Dapat you monitor. Kaya yung nga sinasabi natin na you teach your patients to be what? To be able to take care of themselves. No? They know how to do their blood pressure. Tingnan nila yung manas nila. Tingnan nila yung heartbeat nila. Maging observant sila kung sa ano yung mga nararamdaman nila. And when in doubt, that this is what I tell my residents as well. Now, when in doubt, and it applies to the mom, call your healthcare provider, call your pediatrician, call your obstetrician, and so that, you can be given a good advice.
There you go. Now, Doc, for lactating moms naman po, what vitamins or vaccines should they take to boost the immune system?
Good food, healthy food, okay? We have outlined to them already what are going to be sources, of what is going to be needed, If despite, okay, the very balanced diet that they're taking and they would still want to take multivitamins, that's all right. Could they take the mama supplement, okay, the supplement for lactating moms, okay? Of course, okay, all these things though are going to help, especially so may mga milk for lactating moms na meron ng malunggay content. That is going to be good for these breastfeeding moms.
Got it, Doc. We also have a couple of questions also about yung list of things or products, soaps and lotions that are safe for pregnant women.
Naku, napakadami naman ng listahan na yan.
Or ano na lang po?
Dapat walang parabin.
Okay yon, Doc. That's what we need to know. We have to know na lang po yung mga ingredients. Ganon.
So walang mga kumbaga sa pagkain, walang mga additives para mas simpler, mas better. Napakahaba ng listahan.
Basta you have to, I think, also just be in charge of
preservatives. You'll have to be
preservatives there. So very, very gentle as much as possible. You know everything that is in the ingredients list. And they very much have to do with, kasi Doc, di ba, it's gonna go in your body somehow, di ba, papasok yun. So kailangan talaga careful. Kaya, okay, Doc. So our question number 5 naman po is, how about Doc, patients with hypertension on her second trimester, no follow-up checkup uli, can she still continue the medicine given by the OB?
Okay. Take note of her blood pressure. So kung kaya sabi natin, meron ba siyang, kung wala akong blood pressure, maybe siguro kung maghanap ng kaibigan na siguraduhin lang na ito walang exposure to any of the virus. So she needs to take note of her blood pressure. She needs to take note of her symptoms. Nahihilo ba ako? Sumasakit ba yung ulo ko? Nagdo-double vision ba ako? Nag-iedema ba yung mga paa ko? All these signs though that can tell you that you need to take your blood pressure, and that's going to be one thing. If, for example, wala talaga and she doesn't feel well, okay, then that would be the time to tell her healthcare provider, her obstetrician, kailangan mo kung makita. And then they make the arrangement.
Okay, noted, Doc. And I think I have a question here. Doc naman, in this situation that we have, in COVID-19, and you're a mother or you're pregnant and you have to breastfeed, can you give advice to mothers out there who are afraid to touch their babies because of this social distancing and quarantine?
Okay. So napaka-importante yung precautions na sinabi natin, no? Yung hand washing for at least 20 seconds, no? Every 2 hours if it's going to be possible. And then everything that she needs to wear the necessary precautionary kumbaga gamit, no? Yung mask, no? Napaka-importante yan. Dapat may mask siya. And then yung cleaning of surfaces, which is also going to be important, and the respiratory etiquette. So with that though taken into considerations, okay, then she can just express her breast milk if she doesn't want, and if she's really afraid of, ayoko dahil ayoko masisi, ayoko maging issue, then the best other alternative would be to express that particular breast milk. And if she is able to probably get, okay, yung screening test, okay, to prove that she doesn't have, okay, the viral infection, then that's going to be beneficial. Ngayon daw, mas madami na tayong testing kits. So that probably is going to help her. If she gets admitted in a health facility, tertiary at that though, and she is a suspected, she's PUI or PUM, okay? PUI, she will be tested. So that's going to be something that would convince her later on if it turns negative, okay, pwedeng mo na kayong i-room in.
There you go. So to the moms out there who are having a little bit more anxiety and worry about being able to have to breastfeed or even just touch your newborn, please remember, we hope that we remove the worry that, this is really a moment for you to be able to bond with your babies. As Doc Joey mentioned earlier, massaging and bathing the baby is very, very important during this new time. And as much as it is important to do these things, it's also important, of course, to pick the gentlest products for the babies. And that's why when it comes to gentle products, of course, Johnson's Cotton Touch, Baby Wash, and Lotion are the ones that Johnson's best hypoallergenic care for newborn sensitive skin. And of course, it's ultra light, not just very light. It's ultra light and gentle, kaya sobrang gaan sa balat. And of course, this is really going to enhance this experience with the newborn. Okay, Doc, thank you so much.
You're welcome. Kat, in
Yes.
case you're wondering what this red ribbon is, no, this is
Yes,
our
Doc.
support for the frontliners, no, and I am not actually one of the residents that or the nurses, okay, in the hospital. I go and see patients, okay, not every day, but I'd like again to thank these frontliners all over the Philippines. But you're going to be saying your goodbyes to them, and I enjoy this moment. And I just would like to say a few words to everybody viewing us. I'd like them to stay at home. Let us all continue to storm heaven. Our intercessory prayers are powerful. And with that, Cats, it's been a pleasure having this session with you tonight. Thank you for having
Doc,
me.
Doc, it was such a pleasure talking to you about all of this, and I really learned so much. I hope our mommies out there learned a lot also. This is Doc, congratulations, our first ever session for Johnson School of Gentle. Once again, thank you so much for joining me, Doc Joey. And thank you so much for all the mommies, the daddies, the families who stayed with us until the end of the session. We hope together with Johnson's baby, we were able to share some valuable information for you and ease your worries a little bit in this very unique situation that we have. Now, you guys can watch out for tomorrow's Johnson School of Gentle because we are going to be with Dr. Marivi Dizon, and she will be answering all your questions about caring for newborns in time of COVID-19. And while you're here, don't forget to follow Johnson's Baby on Facebook and Instagram to know more about caring for babies and kids, and make a schedule with us 7 p.m. tomorrow for Johnson's School of Gentle. Thank you, everyone. Again, my name is Kat Salaw. Doc Joey, thank you very much. Stay safe, stay healthy, and have a good evening.
And to all the viewers, good night.
Good night.
The views and opinions expressed on the show by the host and doctor experts do not reflect the views of Johnson & Johnson or its management. Viewer discretion is advised.
Hello, mommies and daddies. Hope you guys are doing well on this Tuesday. Yes, it's Tuesday. My name is Kat Salaw. Thank you so much for joining us here tonight. And if you were with us also yesterday or last night, thank you very much as well for being back today. I will be your host for another session of Johnson School of Gentle. Now, if you weren't able to catch us yesterday, we were with Dr. Joey Salazar. He is a neonatologist, and he answered a lot of questions about protecting pregnant moms and their newborn babies in the time of COVID-19. Now, for today's session, we're very, very excited to have with us another doctor who will always be there, or who will be there to answer your concerns regarding newborn care and protection, including proper hygiene, the importance of touch, and a whole lot more in the time of this global pandemic. If you have any questions for tonight for our doctor, we are super excited to have her here and to answer all your questions. Please keep commenting on the Facebook page. We will be picking some questions that we're going to be answering later on as well. And if you have friends that you feel need to see this right now, just to calm their nerves and give them a little bit of confidence while we are all staying at home, please keep sharing this video with them too. Now, this is a J&J initiated Facebook Live, and the doctor for tonight is the J&J hired resource speaker to discuss topics related for newborn care. Joining us tonight is a member and past head of the subspecialty group of the Philippine Dermatological Society. She is also currently the head of the section of Pediatric Dermatology at the University of Santo Tomas, and an active member of the Society of Pediatric Dermatology in the United States. Let's all welcome pediatric dermatologist, Dr. Marivi Dizon. Hello, Doc.
Good evening, Cats. Hi, everyone. Thank you for joining us tonight.
I'm so excited to ask you all the questions, Doc. Yesterday, Doc Joey, ang dami niyang natulungan na mommies and daddies. They were so very thankful. So for tonight, it's a brand new topic. And, we understand everybody is going through feelings that because of everything that's happening in the world today, maybe some anxiety, some confusion, and some difficulty with how they can deal staying at home. So we're very, very helpful or very thankful that Johnson's Baby and Dr. Marivi is here to help us, assure us, and just, teach us what's really best for baby. Now, to start, we've gathered some questions submitted by moms, and we will be going through all of these one by one. And afterwards, like I said, all the questions in the comments, we will try to answer as many as possible. Okay, Doc, are you ready?
Okay, Kats. Thank you.
Okay, let's go. So, Doc, let's start with maybe the number one question of moms now in the time of social distancing and, separation, and they have a newborn with them. It's a very unique situation. Can I touch my newborn baby?
That's a great question, and going back to what you had last night, that was an excellent exchange with Dr. Joey Salazar. And if I would want the mothers to have a more in-depth knowledge or to know more about after giving birth, what they can do, I would prompt them to go back and look at the interview you had with Dr. Salazar. But at this point, there's no problem that the new mothers, will hold their newborn babies, except that, of course, in this special situation we are having at this time, the pandemic, the COVID problem, there are regulations that and protocols that each institution, each hospitals observe, just in case that you have a PUI person under investigation or a PUM mother, and or who is a COVID positive mother, and but more importantly, depending on what the newborn's status is, it's still important that close touch with the baby will still happen. Whether it can be immediate or there after everything has been stabilized, more importantly, to touch the baby is not an issue. It's actually encouraged.
So at this time, we really just have to be extra safe. I mean, we understand there's social distancing and the situation right now, but the touch of the newborn is really very, very important.
Yes, because the sooner that the mom is able to hold the child, there are a lot of changes that occur and a lot of benefits that happen between the mother and especially the newborn child, which is again why having that skin to skin contact and or putting the baby close to the mom the soonest possible time is encouraged.
There you go, mommies and daddies. You got it from Doc straight. Please, we hope that we alleviate a little bit of worry that you have when it comes to holding your newborns. I'm pretty sure that they're really going to love and enjoy that care that you have for them. Thanks, Doc. So let's move to the next question. This one naman po about virus and the clothes. So safe po ba magsampay ng damit sa labas kasi baka po kumapit yung virus sa damit namin ni baby?
Nako, Kats, I love this particular issue. And it's a very, very valid issue because the virus, we know that it's all around. But the question is, which one are the myths? Which ones are the ones that we have to allay our fears about that aspect? So when it comes now to baka kumapit sa laundry, first and foremost, let's take it off from how this virus is gets onto the surfaces. So it takes someone who will, let's use the person who is sneezing. So the droplets are out there, but the question is how near or how far is the person who sneezed from the laundry area. So kung kapitbahay mo, wag ka na mag-alala. It's too far. But it's the 3 to 6 feet distance, which matters a lot. But the interesting thing that they are finding out at this point is that the virus doesn't seem to be catching onto soft material. All right, so it's more of but there's still Remember, this is still an emerging infection, and we are still slowly learning more about what this virus is doing and is capable of doing. So, in other words, when it comes now to several objects, um, I will start with what they have found out and is already can be considered as recorded or a fact. For one, can you imagine metal surfaces? So this is the reason now why the doctors and the WHO and the DOH keep on emphasizing you have to clean your surroundings, because the virus can be all right in following surfaces. Metal, would you believe in metal, the virus can be there uh, for 5 days. So when we talk of metal, you see that it's the doorknob, jewelry, and even the silverware that we are using when we're eating. Tapos you have also the glass. The glass, the virus can be there for up to 5 days. And the glass, you see it in the drinking glass, right? Also mirrors. So can you imagine? Those are things that you find inside your house everywhere you go. And then ceramics. Then ceramics also 5 days. You can see it there. And paper for 5 days. Wood, you see wooden furniture, and the virus can survive there for approximately 4 days. What about the plastics? The plastics, milk bottles, the viral and elevator buttons. The virus can be there for 2 to 3 days. And about aluminum, 2 to 8 hours, and copper, which we see in our cookware, it's about 4 hours. But again, going back to yung sampayan, um, the virus seems to be able to slip through porous material, and the clothing material is something wherein, even having said that, we're still encouraged to, the moment we get home, whatever we're wearing, throw it into the laundry and have it laundered already instead of bringing it inside the house. Pero yun nga, yung sa sampayan, uh, just make sure your neighbor is far away.
And siguro, Doc, yung naglalaba mismo, sana wala rin siyang symptoms or hindi siya, vulnerable. Baka wala siyang sneezing habang
Yes.
naglalaba.
Yes. Pero ang ano din edi ano kung meron na siyang symptoms, either the person is home and maybe wearing also the respiratory masks, or the surgical mask, or otherwise they might be going to the hospital already to be seen by the doctor.
Hopefully, nobody at home right now is experiencing any of these situations. But just to remove the worry, at least sabi ni Doc, if you are not the one, at least yung mga neighbors natin, wag na muna natin pa-sneeze malapit sa ating sampayan, di ba po? Siguro that's what we have to be careful for. Thank you, Doc, for that. We have a few more questions. This one naman, Doc, it has something to do with the weather and how it's very, very hot, but they're worried about their babies taking frequent baths. So the question is it okay for them to take frequent baths, or would it result in the baby having colds?
All right. Another good question. Now that it's very hot, the thing is, it's best now for the baby, especially the toddlers. The toddlers, we know they're all over the floor already. They're virtual mops, di ba? Para silang mga basahan. They're cleaning the floors for us, or especially the children. Now, I'll touch on the children first. The problem now here is everyone is encouraged to stay home. So you won't see children running around the streets and getting like something like a heat rash. But even then, when they're inside the house, not unless the AC, the aircon, depending on if the household has an aircon or not, they hardly sweat. But if we're going to look at the big picture, not everyone has an air conditioning system. So it's really hot. So everyone's going to sweat, not only the children. And so what the best thing to do is they can take a bath. You can give them a bath. They can take a bath. So that will relieve them of the sweating, which actually the sweat can irritate the skin. We can have heat rash. And you know already what happens when there's a heat rash or yung bungang araw. It's
Yes.
very itchy. And kids will be kids no matter what happens. When it's itchy, they're going to dig into that skin. So once that you see that the kids are digging into their skin, you know already that there's going to be a wound, and the likelihood of one developing a bacterial infection, the risk becomes higher. Mas malaki ang chance na magkaroon ng mga bacterial infections. And the perfect example of a bacterial infection, yung mga pizza. All right? So
Very true.
so before you encounter those kinds of diseases, bakit mo pa aantay na magkaroon ng ganon? Let's prevent this complication of having a bacterial infection. Paliguan ang bata twice a day. It cannot be once a day. And I just want to emphasize on that once a day bathing, all right? I see that a lot of families, a lot of mothers or the one caring for the child, they have the tendency to bathe their children once a day. And they bathe the children once a day, that's in the morning pa. So can you imagine, naligo sa umaga, then these kids are like, spinning tops, or they're like Tasmanian devils, they're all over the place. Tapos, pagdating ng hapon, hindi na maliligo, and they have all the bacteria, all the dirt on their skin. They don't take a bath anymore. Bakit? Anong rason? Mapapasma daw yung child. Let's keep in mind, let's remember that pasma is a myth. And the thing is, the benefit of bathing, everyone for that matter, whether it's a child or even an adult, in our hot, humid weather, especially now, it's going to be a scorching summer. To bathe twice a day is the best thing to do.
There you have it, ladies and gentlemen, moms and dads. Pag sinabihan kayo ng mga anak nyo na naligo na sila, no. Doc Marivi said twice a day. I'm also speaking to people who feel like staying home is very relaxing and, they don't need to bathe at night anymore. Twice a day, most especially with this hot weather. And it will not cause colds or pasmado for your babies. Okay, thank you for that, Doc. Now, when it comes naman to bath time with the newborn babies, is it safe naman po to use germicidal soap for their bath? I saw your reaction, Doc.
That's very close to my heart. No, your question is very close to my heart, but the germicidal soap is not. It's social distancing. Not only social distancing, galactic distancing. Oh my God! Let's put it this way. All right, let's go now to the role of soaps in our life. Soap is essential in our life. All right, simply because the cleansers. I'd rather use the word cleansers or soaps, but cleansers. The cleansers or soaps are the ones that are absolutely capable of driving out the dirt. And when I say dirt, that would also include the bacteria or even this virus. It can take it away from the skin. So, but now we have to realize that with the use of the soaps or cleansers, it's not that simple either. Especially if we have a newborn, a neonate, a baby, the thing is, the skin of an infant is maturing or developing throughout its first year of life. So the moment the baby is born, the skin is not yet mature, not yet fortified like that of an adult. It takes approximately 1 year for that skin to become fully developed, almost equivalent to that of an adult. So if we try to grasp already that statement, there's only one word that will encompass that long statement. The skin is immature. The skin is not that strong enough to still protect the child fully. Imagine it's like you have your house and then you built your house, but unfortunately, when it came to the roofing material is still not very, it's not of good quality. So imagine that is the skin of the child. You're still working through the roofing materials. So anong mangyayari kung hindi magandang roofing materials mo? Di lahat from the roof, from everything from the outside, papasok ng madali. So the skin is like the roof of the house. Anything can penetrate that immature skin. And so we're talking of also allergens, substances in products that we use all around us can easily penetrate that immature skin and create an allergic reaction or an eczema. And also, of course, it can also allow the bacteria to enter. So so you have already an immature skin or a continuing developing skin before it becomes fully mature. Now, we need now to use a gentle cleanser to address that sensitive skin. Immature skin is sensitive skin. So because what we want is that for that immature skin, on top of that immature skin, are friendly microorganisms. Oh, you have no idea how many microorganisms we have on our skin. As we speak right now, those microorganisms are busy keeping our skin nice and healthy right now. And that's the same situation for the infants and the newborn. But the problem now is if we are using harsh soaps, a germicidal soap, let's be factual here. Yun naman ang normally nakukuha sa mga grocery, yun ang nasa grocery list eh. The common bar soap. And usually the common bar soap is germicidal. You cannot use that for a child because it has a very high pH, it's highly alkalinic, and that highly alkalinic soap is going to wear down the infant's skin. Now, the infant's skin will get easily dried out. That's another thing.
Mhm.
So with and that's ordinary soap pa with a high pH. Wala pa dyan yung germicidal cats. You mentioned germicidal. What do these germicidals contain? They contain triclosan. They contain triclocarban. The US FDA had already released a statement, say about, I think that was about 5 or 6 years ago, that there is no there is no proof that will show that the germicidal soaps are efficient. And as a matter of fact, they can again create a problem on the skin. So what's the point now of having the germicidal soap? Not unless you're a surgeon who needs to do surgery, but otherwise, a the general population, it's good enough already to use a gentle cleanser, especially for the infants, more so the neonates or the newborn. So the gentle cleanser is the best one, because the gentle cleanser is the one that will, one, not irritate that immature skin, or that skin that is still continuing to develop, and also is gentle, that it's not going to make gulo the normal microorganisms that's on top of that skin. Those guys are busy again keeping that skin healthy. So so that's why I emphasize that you cannot just use an ordinary soap for your baby. Alam ko din ang issue ngayon. Lahat nagmamahalan. And but believe me, it's not worth na nagtitipid ka with the soap when it comes to your baby. Why? Sige, nakatipid ka sa soap. Pero guess what? That rash is gonna come out. And you will be very problematic when that rash comes out, more so if it becomes a very, very problematic rash, which is an infected eczema. So let's do it from the get-go. You use a gentle cleanser, and then the problem that will come your way, very, very low probability that it will.
Right. Because, Doc, of course, you mentioned, and we mentioned it often, that prevention is really so much better than having to go through difficulties, having your baby checked with the rashes, lalo na now na we really can't step into a hospital.
No, we can't. But and sige, of course, the concern of, I don't want to use the word fear. The concern is valid. Sino ba naman who would want to subject their child to go out into a hospital that the war is there? Siyempre, tulad ng sinabi ni Dr. Salazar kagabi, benefit versus the risk. You know what? If you guys are healthy, stay home. And at this point, now we are into telemedicine. And our term for it, teledermatology. So the telemedicine has been around for quite some time already, but not that much yet here in the Philippines. But you know what? With this situation right now, you can consult us for the dermatology aspect. But of course, for other specialties, especially in pediatrics, hey, you know what? You'd better hook up with your pediatrician, with your neonatologist, and it's best that you are in constant communication with them. So, but otherwise, if you, it's absolutely necessary that your child or your children have to be seen, then you have to contact us. Then we have to make an arrangement how we are going to see you. But again, let's see if the institution is not the referral center of the COVID, then we can refer you to a colleague who is not whose practice is not in a war zone. So that depends now who your healthcare provider is.
And we hope that moms and dads out there don't have to actually step out of their homes. Kaya prevention over cure. We have answered the question about germicidal soap. Yon ang social distancing natin according to Dr. Marivi.
And when it comes distancing.
Galactic distancing pa. And of course, when it comes to gentle cleansers, it really is so important because, you know, let's just wait for the baby's skin to mature a little bit more. But a newborn skin talaga po, it's very, very sensitive, even more than any kind of skin, I would like to say, Doc. Am I right?
Yes.
Any kind of skin. And so we only need the gentlest products. And of course, when it comes to the gentlest products and the gentlest things for our babies, that's where we have Johnson's Cotton Touch. They have baby wash and they have lotion as well. It's Johnson's best hypoallergenic care for newborn sensitive skin. It's ultra light, so you don't really have to worry about the rashes coming out or the dryness, because it's also allergy allergen-free. Diba, Doc, you were mentioning earlier na it's very, pumapasok sa roof or sa
Yes.
skin ng baby, lahat ng mga scientific ingredients na I can't remember anymore. Well, according to Johnson's Cotton Touch, they have removed all those nasty ingredients so that it's really, really so pure for your baby.
You know, Cats, one thing, the one thing that I loved about this cleanser, you know, I'm sure a lot of mothers can relate to this. When they're bathing their child, and not only the mothers, lalo na ngayon, the fathers are now stepping in big time in caring for the child. And one thing that, especially amongst the fathers, they are so afraid, and it's valid, that why is it that when they're bathing the child, it's like it's slipping, that the baby is slipping away from their arms. Well, you know what the surprise is? There's another that has upgraded with this cleanser. You will see that there is that non-slippery feeling when you are bathing the baby with this cleanser, the Cotton Touch. It was an amazing upgrade. So that's another advantage of using the Cotton Touch.
It's allowing you to really be there, gentle touch with your baby.
And it doesn't feel that it's slipping. Talagang dumudulas. So it's a nightmare that you feel that your baby is suddenly going to drop in the tub.
The tub, yes.
And so, but now it's like, wow, it's easy. It's like I have a better grip with this compared to the other slippery cleansers.
I guess, Doc, that will also give them sort of a better bathing experience because
Yes.
they remove the fear that they will accidentally slip from their baby's hold. Well, Doc, from bathing, let's move naman po to lotion because, you know, keeping your skin moisturized using lotion, it's very important even in this hot weather. But the question now is, do I need to put lotion on my baby kasi ang init and he doesn't like it when the lotion gets sticky?
All right. That's another good question. And yes, we, especially us girls, we can relate to that, right? It's a matter of, we know what sticky does. We don't like sticky, especially in this hot weather right now. The lotion is very important, all right? The moisturizer or the emollient is very important for skin because there are factors that can break down the skin, and the one that may repair that breaking down of the skin is putting on an emollient or a moisturizer. On the other hand, even if there is no problem at present, the moisturizer is something that will keep the skin fortified. So now, there are certain emollients or moisturizers that that don't feel sticky or are not heavy on the skin. So now it's a matter of, moms, I want you to be the ones who will try the moisturizer on your skin and see how you feel. What does it feel like? So, one thing for sure, when it comes to infants, they're not going to complain that it feels sticky. The ones who are going to say something are the kids already. They're going to say, I don't like this. You know how it is, right?
Yes, though.
So, but usually, especially with the moisturizers now, that feeling, that sensation of stickiness is already addressed. So it doesn't feel heavy. It doesn't feel hot like your typical petroleum jelly. Now that is really heavy stuff. But otherwise, the moisturizer nowadays, it's not that sticky to the skin. Okay, that's one. Two, it's important that you put moisturizer on your skin. Again, I will refer to one factor that can irritate our skin. I said it already a while ago. Sweat. Sweat can create an irritation on our skin. It's going to make us scratch. So the moisturizers, to a certain effect, are the ones that can try to prevent that or try to repair a skin that is breaking down. All right. So, but otherwise, and now with this pandemic situation, all right. So if we're going to use the moisturizers, especially us, the adults, those who are taking care of the kids, isn't it? We are now advised to frequently soap your hands, frequently put alcohol or hand sanitizer on the hands. Well, you know what? After that, remember this: alcohol or hand sanitizers, which are alcohol based, you know that it easily dries the hands out, right? And when it dries out, you now feel that bakit parang masikip ang kamay ko when I make a fist. It feels so stretched. It feels mahapde. It feels like it's stinging. So all that already are red flags that your skin is about to have an eczema. It is now been recommended, matagal na to but the American Academy of Dermatology and even the Philippine Dermatological Society, we have always recommended that with each this putting on alcohol, immediately you can put a moisturizer on your hands. All right, so that your skin, your hands is not going to suffer from the dry eczema that will potentially develop from the frequent application of the alcohol.
That's true, Doc. A lot of
Right.
these people have really dried out their hands. Most especially we put on alcohol so often now.
Yes. Kasi you're caring for your baby. What happens now? You're always washing your hands. You're using that God-forsaken germicidal soap. Oh, God. And stay away from that thing like the plague. And then like the pandemic. And then now you are getting sick. So that's why you take care of yourself as well. Not only your baby, because your baby is already getting moisturized. Now you need to pay attention to yourself as well. And the moisturizer that you're putting on your baby, you can actually put it on yourself. Hey, isn't it? If it's safe for baby, of course it's going to be safe for the adults. So why am I going to ship to another moisturizer?
That's
See?
true. That's true, Doc. We always forget, I guess, because the weather nga, it's so hot and people feel like they're discouraged to moisturize kasi nga napapawisan na sobra.
Yes.
But that's when it comes to the products that we use. There are non-sticky formulas. And you're right, Doc, no? If it's good enough for the newborn baby, then, and if, you as well.
From the baby, even us, we are babies. And even when the moment we cross the horizon of being senior citizens, the more that you should take care of your skin, because now your skin is almost like that of the baby, very sensitive. Physiologically, there are a lot of changes that's happening that as we go through the years into the horizon of age. So what's good for the baby, it's good enough for us.
There you go. And as gentle as the products that we have for the babies, maybe we can also use it for ourselves. Absolutely. Don't forget to moisturize. To answer the question, yes, you must put lotion on the baby, and kung naiirita siya dahil sticky, better use a non-sticky or non-sticky formula like Johnson's Cotton Touch baby lotion. It's actually water-based, so hindi talaga mai-irritate yung skinny baby. And Doc, I noticed or I realized that babies won't be able to communicate nga with us if they're sticky, no?
No, it's like, can you imagine you're putting it on a little tot and it's like, me not liking, oh my God, I will be afraid.
And I
Wait,
mean,
you're 1 month old and you're talking. Oh, I don't think this is right.
so gamitin na muna natin yung mga lotions on the mommies and daddies, and then if we don't feel at all the stickiness, then of course it's going, the baby will be a little bit safer.
Yeah.
So, Doc, when it comes to lotion and baby powder during this pandemic, is it okay to apply lotion, baby powder? Because some say that the virus will stick more if you use lotion.
No, I have, I'm not sure where that information came from, but absolutely not. Imagine again, why will the virus stick to the lotion? The thing is, um, you are all the lotion is needed for you to repair your skin that you are frequently using, washing your hands and putting alcohol, but there's no um uh research or finding that categorically states that the virus it will stick on lotions. No, there's no information about that. Um,
So,
also, what else? What's the other issue?
lotion
Ah,
po or
Other.
powder?
I leave to the mothers. I leave to the mothers whether they will use powder or not. But for me, I don't find any issue. For me, it's okay to put powder, especially for the kids who are running around. You can put the powder on the sweaty areas, the back, the folds of the skin. You can buff the powder over those sweaty areas so that it will absorb the sweat. It will create a barrier from the sweat not to touch the skin, and therefore it's going to prevent the occurrence of the heat rash or yung bungang araw.
Sweat is really the enemy when it
Ay,
comes to rashes, no?
yeah, well, okay, the sweat, of course, is beneficial also. Remember, I take reference to dogs. I'm a dog lover. You see that the dogs, they pant because they don't have sweat glands. That's the way they're able to release their heat. Magpapant sila. But tayo, we are able to temper down our body temperature by sweating. Sweating is good. I will be more afraid if a person is born unable to sweat. There are genetic conditions they have that. So if you don't sweat, you're going to have hyperthermia. All right? Mataas na mataas ang lagnat. But sweating is absolutely good. But sweating also can just create some little problems once in a while, and it's the heat rash. But when the heat rash is being scratched tremendously by the kids, they digging in, it's no longer a small problem. It will create a big problem.
That's what we really need, Doc, talaga, to prevent the bigger problems from
Yeah.
happening, most
Yeah.
especially now that we're all at home.
Oh yeah.
Doc, we have another question naman about here po from another mother who says, I'm concerned that my baby and I will both get sick because he's still very dependent on me. I think, Doc, this is breastfeeding and sleeping. So touch rin po siya.
Yeah, a lot, of course, it's a lot of mothers, especially the first time mothers, maraming they have a lot of fears because they're unsure of what they're doing is it right? Is it wrong? Because at the end of the day, the last thing they want to happen is to syempre harm. They don't want to harm their precious child. But we can only reassure you, you are doing the right thing. Don't overthink things that hahawaan mo siya in the first place. Meron ka bang simptomas? Sinisipon ka ba? Inuubo ka ba? But wag mo namang isipin na, oo, mukhang sinisipon ako kasi you know that the brain can also create a problem na it
True.
turns on something that the body might respond to it. So relax, listen to beautiful music, and make it a beautiful experience that you are close to your child, because if you have that skin to skin touch with your baby, your precious one, again, there are a lot of things that are that the benefits are far reaching for both of you. This the growth and development of your baby is tremendous, is absolutely amazing if your baby constantly feels you. There's already that communication between you and your baby, and even neurological development, intelligence, psychological growth, everything, physiologically to mental aspect, your baby is going to benefit a lot, and your fears are are are, are unfounded. There's don't don't be afraid. You are good. So just go through the motion of being with your child and know hindi mo siya mahahawaan. And if you feel you have sniffles, put on a mask. That's
Mhm.
it.
Doc, I think that was so important for a lot of the mommies and daddies to feel, because in this time, diba, a lot of anxiety, a lot of fear surrounding it. So it was really, I think it's very, very important talaga to come from a professional that, to give them the advice na tanggalin na muna yung worries and enjoy the time that you have with your baby.
Yes. And especially now, it's like all of us, we're like on forced vacation. We're in our homes. So um make the most of it, and but don't keep it pent up in you. You have to talk to someone. You need someone to be with you through this experience. So if not your family who is with you in that home, hey, thank God for the connectivity in this day and age. My gosh, can you imagine what our grandparents had to go through during World War II or even World War One? How on earth were they able to communicate with each other? Here, at least, the net is already making others close to us. Even if it's in a screen level, at least we see them, we hear them, but more importantly, don't keep it to yourself.
It's so important that you mentioned that, Doc, because here the Johnson School of Gentle, we're really trying to help the moms and dads there who are maybe have a lot of questions. And you mentioned about having to open up to other people
Yes.
and make sure you have a support group. Now, the last question from the list right here is: given the duration of the enhanced community quarantine, will there be any negative psychological or physiological effects on the children? And Doc, if yes, what would they be, and how can we prevent or help prevent them from happening if possible? I see your smile, Doc.
Yeah, this is I look at this. I look at this quarantine or what's happening. It's not only happening in the Philippines. We know that worldwide, all of us are suddenly we are we see how cohesive we are as a family, how resilient we are. Or well, sadly, let's face reality, the dysfunctional issues are also come out. But now it's a matter of we now take advantage of being with our family, the the, the core of what the world should be. It's and we just have to communicate with each other. Also, of course, the level of maturity is there, but we communicate with each other. We have to understand each other. We have to have empathy, compassion. Um, But of course, again, how will you be able to contain if there is problem brewing within that quarantined house? Well, realistically, it's difficult. And to say that no, everything will be okay. No, for me, that statement is rosy and not realistic. There's a lot of psychological stress that can also happen. And we just have to find, all right, number one, how can we cope with the situation? Positive, no, especially the negative. So if we are able to cope coming from our self, our inner self, so that's where, all right, praying, meditating, or maybe looking at outlets. If you're good in painting or sketching, or bring it out now. Maybe now this is the time you will see that I didn't know I have a talent and I can bring it out, my angst, by drawing, by by sketching or playing a guitar or something. But now when it comes to the outside, sometimes it can't be met that we need at times professional help. Now this is where I will say that do not hesitate to talk to someone. Nowadays, it should not be a taboo. It should not be looked at in a negative way that you need a psychologist, you need the help of a psychologist or a psychiatrist to talk it over whatever is burdening you. Again, I will not, I don't subscribe to, oh, you're just thinking about that, this is what you can do to unload it. No, at times it's real. Mental health, it's real. And so this is where I say that there sometimes there are certain situations that your own family cannot handle it. Do not hesitate to reach out to someone who can help you navigate that difficult mental issue that you're having. And in my books, it's not a taboo. You need help, call. Look for the people who understand how to approach your issues.
That's all right, Doc. And I think now that all of us, everyone in the world is going through a level of stress that we really were not prepared for at all. And so it really is important to care for not just our newborn babies or the people around us, but our own mental health as well. So, Doc, siguro this is the perfect time that they can call up the doctors that they were too afraid to see.
Yes, yes. But again, you have to ask yourself, but again, don't hesitate to reach out. Don't, because you may be, you have a baby who needs you. How now will your child be able to connect to you when you are the one who is having some glitches? So essentially, let's not forget that we have to take care of ourselves as well so that we can deliver and translate that care to the child who needs us most in these trying times.
Doc, I think our viewers are hugging their babies and their mommies, hopefully now.
So,
I would love to hug my mom with what you just said because of all the stress that's going on. But we still have a few questions. Doc, that was it for the questions we had. I hope the mommies and daddies and the families tuned in are still there commenting their questions and sharing the Facebook Live because, this is what the School of Gentle is about, really trying to help ease your worries and do what's best for babies. So, Doc, we have a few questions now. I found them. Okay, so first from our Facebook comments, if I have a newborn baby at home, are there extra precautions we should be taking right now?
Oh, all right. Well, of course, number one, I know that there are no visitors coming to the house at this time because everyone needs a quarantine pass to get out of their territory. But you just have to what can you do to protect your child? Well, one, make sure no one's getting sick at home. Two, always make sure that your the surfaces of your house are clean. So because again, I mentioned how the virus or bacteria stay on surfaces. So you just make sure it's your surfaces are clean and you are properly cleaning all the items that you're using on your baby. But otherwise, now to say that visitors are not allowed, you're not having visitors. They're not
Actually
coming.
safer.
Nuh-uh.
That's true, Doc. I know of a lot of friends of mine that you're not allowed. Visitors are not allowed to even kiss their baby.
Oh
That's how
no.
that's
Yes.
how safe they are.
No, don't kiss the baby.
So, Doc, another question pala. This was also asked yesterday, but I know a lot of mommies are worried. Is it safe to go out to visit the pedia? And what if it's an emergency?
That's a very good question. Is it safe to go out to to your pediatrician or to the doctor? Because it can be a pediatrician or the general practitioner or the family practice physician. So you have to think of benefits versus risk. If your child is not in any danger, then you can communicate with your primary care physician. So whether your primary care physician is a pediatrician, a general practitioner, a family practice physician, then you do it like this, like telemedicine, making use of the net, making use of Zoom, Skype, Facebook Live, etc. But if now you need really the urgency is there, you again have to communicate with your doctor and arrange where can we meet. I am not going to bring my child to the war zone. So you have to talk to your physician. Kausapin mo yung doktor mo. Doctor, where will I go now? Eh, nakakatakot. Parang nakikita ko yung malaking bola na maraming spikes nasa labas ng gate ng ospital eh. You know what I'm talking about? And so,
Yeah.
wag natin pilitin. Merong mga ospital or clinics na they're located away from the war zone, and that is why may referral system kami. We can refer, or your child can be referred to a colleague that your physician feels comfortable passing you on to. So, but otherwise, risk versus benefit, syempre, you want everyone, not just your child, we want everyone to be safe and healthy. So always call your physician before going out there and risking it.
That's true. Doc, all the doctors I feel now are really working together. I mean, you mentioned na, there's going to be a referral system just to see what is really safe for the mommies and the newborns. So I hope that the mommies and daddies out there really feel a little bit more okay when it comes to communicating with your doctor. I mean, now more than ever, they really have to have that open conversation with their doctors. Doc, we have another question here.
Sure.
It's a pretty long one.
Oh, bring it on.
Okay, here we go. So the question, Doc, is in normal times, there is no urgent need to get the newborn baby bathed. And this can be delayed at the parent's request. But presently, I am in charge of babies born to COVID PUI and positive moms. The baby needs to be bathed as soon as possible when its temperature is stable to remove the virus-laden droplets acquired during delivery. Which J&J product would be best recommended to accomplish that?
No, okay. Now, for me, I would say that depends on the hospital protocol of the hospital that the baby has been delivered. So I that I will not answer categorically what. I will maintain that it's important that no matter what happens, trust that your baby is being taken care of, and whoever the uh, health care worker who is handling that child, for sure that institution has a protocol. And the only thing is you can only use the cleanser that is being used in that institution. So
Mhm.
that's how I'm going to answer that question.
As gentle products po, for
Well,
sure, that's
for
what they're
sure,
going to be using. Yeah.
I would say that no hospital or no healthcare or any institution is going to put anything in their hospital that's going to be detrimental to the child.
True.
So I would say again that um, the they cannot control. I don't think that they will be able to dictate what's going to be used in the child. Now maybe it's already when they get home. That's
Mm.
where the ball game can be played according to what you feel will be good for your child. But when it comes now to protocols in institutions, in hospitals, trust your hospital. Trust your
Trust her.
pediatrician. Yes,
Very
trust
true.
your
Very true.
pediatrician. Your pediatrician is not going to recommend anything that's going to harm your child. So trust.
Very true.
Yes.
Yes, Doc. Very true. Kasi they know what's best talaga for your newborns. But when it really comes to gentle products, of course, the Johnson's Cotton Touch is really the most gentle for newborn sensitive skin.
Yes.
And I know that it's so gentle, you can actually use it for first bath of
Mhm.
baby.
Yes.
So if the moms and dads out there, if they really want to try a product out for their baby, the newborn, and they're worried about what the hospital is using, then Johnson's Cotton Touch could be an option for them.
Yes. Yes.
So, Doc, we have a few more questions here from the comment section of Facebook. It's been
Okay.
blowing up, but we picked a few na lang.
Good.
So, Doc, we talk about naman po, mga rashes. So,
Okay.
paano po
Sige.
mawala yung rashes ng muka or sa muka ng baby?
I love that question. Okay. If we're talking of a newborn or neonatal stage, ganito lang yan. There are rashes that ang tinatawag namin can be considered as physiological changes of the skin seen in a newborn or a neonate. Now, if I'm going to think of a few that lumalabas sa face, you know what? You'll be surprised. Some neonates, they can have acne, pimples. Baka may
Baby.
nakadate sa newborn services. Oh my gosh, mom, no. Okay, like this. Okay, because that's one thing that can create rashes on the face, huh? One, your precious one, your newborn precious one is having pimples. It's like, what? Pimples? I thought that was just for teenagers. Naa. The hormones of the mom, napapasa yan sa child. So now the thing is, the hormones of the mom is creating activity on the oil glands of the child, of the infant. So now magkakaroon siya ng, okay, I will just use common words, baby acne. Okay, baby acne. So don't worry. This is the reason why we pediatric dermatologists are around. We can help your child to get through that stage. But kasi ang concern ng mga moms, oh my God, my baby might have scars on the face.
Yes.
Oh, diba? It's like, naku, baka magkaroon ng peklat. But bring your infant to a pediatric dermatologist. We are here for you to help your child get through that, one of the physiological changes seen in the newborn. So that's one. Number two, there's also changes on the skin, on the face, that neonates will be manifesting with. That is also seborrheic dermatitis. All right, seborrheic dermatitis. It's like tanda natin in adults, you have dandruff. Now, in the infants, you have the cradle cap. That's seborrheic dermatitis. Pero yung cradle cap na yan, that's seborrheic dermatitis. It does not only manifest here. We see it also on the face. We see it on some other areas of the body. So, again, don't worry. We can address those rashes that's popping out on the face of your newborn, of your neonate, of the neonate. So again, no worries. We have ways to address that. But the thing is, bottom line, first step, use a gentle cleanser to clean everything. That includes the face.
And make sure that you have a pediatric dermatologist on call.
Yes,
so
and
that
don't self-medicate. Don't listen to your neighbor. For all you know, your neighbor may be an evil neighbor.
And get away from the germicidal soap, Doc. Baka yun.
Oh God, like the plague.
Oo, nag-rash dahil doon, Doc.
Yeah.
Doc, we have another question pala over here.
Sure.
What products can we use to sanitize baby's skin also? We disinfect naman kami pag galing sa grocery, pero just to be safe, can we also use products for our baby?
Yeah, that's a very good question also. Okay, when you need not sanitize your baby, okay? In the first place, the soap, just bathing with soap, water and soap, guess what? That's enough. You don't need to think of, wow, am I going to use a disinfectant on my child? In the first place, if you're going to use a disinfectant, nakaka-irritate ng skin yon ha, on a skin of a baby that's still continuing to become mature. Yon ang tatandaan nyo. From day 1 of life to year 1 of life, that skin is at the age 1 year, that's the only time that it almost reaches full maturity. So, huwag niyong isipin na I need to make my child germ-free. You know, that's another thing. That statement is pardon the word, bastardized. I think it's overused, and all of a sudden, all of us become so paranoid. Oh my God, so full of germs. Remember that there are healthy microorganisms or
Okay. Siguro, what was your last question again, Kat?
Number 4, I was talking about
sanitizing.
So, okay.
So, Doc, we'll talk one more question for you kasi we're worried about the sanitation or sanitizing constantly. So, there's a question from the comment section. What products can we use to sanitize baby skin? Kasi we disinfect naman kami pag galing sa grocery, pero just to be safe, can we also use products for our baby?
Okay. The word sanitize, that phrase sanitizing the baby, I'm a little bit worried because when I hear the word sanitize, I'm already imagining that the one who's taking care of the child is already putting on alcohol, everything, basta to disinfect the child, make the child germ free. Okay, one, be careful of using the word sanitizing and you overzealously disinfecting your child, because when I hear the word sanitize, immediately what comes into mind are disinfecting products. So, what are the disinfecting products? These are the products that are alcohol based. So, we're talking of hand sanitizers. We're talking of the isopropyl or the ethyl alcohol. So, no, you don't need to do that. Because remember again, the biggest message that I want everyone to remember is that from day 1 of life to almost year 1, 1-year-old yung bata, year 1 of life, that skin is still developing. Immature pa, hindi pa fully developed. So that means that skin is very sensitive. Now, if you are sanitizing, I'll use that word that was part of the question. Sanitizing the child, those alcohol-based products will be frequently wiped on the child, and it's going to drive the presently immature skin to become dried out. It's going to strip of its natural moisturizers on that skin na immature pa rin. Makulit ako ha. And then it's going to create an eczema. And I swear to God, your sanitizing strategy will bring the child to a worse situation. An eczematous skin that potentially will become infected later on. Kasi eczematous skin, it's already gates wide open. Now, you don't need to sanitize your child, but let's change the word. I want my child to be clean. I want that skin to be healthy. And the only way to do this is back to basic, simple principle. Gentle cleanser and water. That's it. You don't need to disinfect your child. You're going to create a big problem. You came from the grocery, you're worried that your child picked up something in the grocery. Simple. Bring him to the shower area and gentle cleanser, rinse. Our Lola said it best. Sino sa inyo nakarinig ng paligong uwak? Yes, they were right. Initially, I was thinking, why? How does an uwak take a bath? Do they sing while they're taking a bath? No, it's madali ang paligo. But otherwise, gentle cleanser and water. Tapos, don't use alcohol-based products on your skin, baby skin.
I think it's more, they want something that, a situation that is safe, but it will actually in turn cause more problems in the future. Yeah. So,
there's another thing, Cats, that I want to drive, ha. Be careful of those sanitizing products as well. Why? Tandaan nyo, there are a lot of components thrown into a product that's disinfecting. And some of those can be toxic. Some of those can be, some of those products can, if they enter that immature skin, and imagine it's porous skin. Imagine para siyang spongha na madaling lumusot. Can you imagine now ang implication if the toxic ingredient gets into the body, into the system of your child? Your child, I don't want to end the sentence, but it's not going to be a pretty sight. It's not going to be a good situation. It's going to be a grave situation. Pardon the pun and pun intended.
But that's exactly what we don't want to be happening in this pandemic that we're feeling. We want to stay safe. We want to stay at home. And so again, like Doc said, if you are worried about, the sanitation or sanitizing your baby, it's really just best to give them a bath and, make sure that you use the gentlest cleansers. That's why, sobrang dali nga, Doc, kasi there are gentle cleansers like Johnson's Cotton Touch, top to toe baby wash. It's just one for the whole baby. And then, like Doc said, even if it's hot, we really have to keep moisturized with products that are non-sticky. Perfect example is the Johnson's Cotton Touch face and body lotion, because it really will, ultralight, not be sticky on the baby's skin, and also for us, us adults as well. We can't be sticky now. Yeah, our
Lola can you also use it?
Oh, so we can all be non-sticky together, diba, Doc?
Yes.
Diba? I mean,
right.
So, Doc, we have one more question here from the comments. And first of all, thank you so much for everyone and for Doc for joining us, because we have one last question that we're going to be asking. Hopefully, everybody enjoyed the conversation. But before we go, Doc, is it safe to use lotions or moisturizers on newborn babies as early as first day of life? How early in their life should we try, or to apply lotions and moisturizers to their skin if it's super sensitive?
Moisturizers, there are already studies that have come out that even on day one of life, you can already use emollients. All right. So, but of course, moisturizers are essential in our daily life. So, because there will, as our skin, even if it appears to be healthy, there are factors both from outside, external, pati from inside, internal factors that can create that skin to break down at times. So at least ngayon, the moisturizers or the emollients are good to be incorporated as something that is basic in our self-care, in our skin care. So uh, my peg always to my patients or to the mothers or to the parents, next to brushing your teeth, teach your child to grow up thinking that moisturizing is integral to the daily ritual. So at least we are able to keep that skin healthy by one, using gentle cleansers when taking a shower twice a day. I'm going to emphasize twice a day,
Twice a day.
right?
Okay.
Yeah, in the Philippines, in this hot, humid weather, twice a day. And then moisturizing. Because after all, we don't want problems to come in easily. That challenges our skin first and foremost.
Doc, thank you so much because you've really enlightened all of us. Is there anything else that you'd like to advise to the mommies and daddies who are still tuned in now?
Yeah, okay. Um, Congratulations if you have a newborn. And yes, and it's like no matter what the situation is, it's like look at each other, and it's the best gift that you will ever have on this earth. And it's like that alone, not you are okay. We know that you feel that you don't want any harm to set upon anyone for that matter, especially this new kid in the block, this new child, this newborn baby. Don't worry, you're already getting advice. All, not only from your readings, but when I say from your readings, you have to be critical and analytical of what you are looking at on the net are legitimate sites. I have to emphasize that.
Emphasize.
Yes, yeah, because we know there are a lot of very good references on the net, but there are some very uh, uh, not worthy to look into. So look, make your research. You're doing okay. If not, there are people out there that you can easily get in touch with. We're here, the healthcare providers. You guys are there, the J&J people. They, at least, thankfully, they have a contact, a way to contact them, and you can talk to people who are going, the experts who will be able to guide you on this new fun journey.
I
All
think, Doc,
right?
that's so important that you said fun journey because, I don't know if fun has been a word we've been thinking of these last few weeks, but that was very comforting for everyone just to really enjoy this moment, these beautiful moments that they have with their baby. Dr. Dizon, thank you so much for joining us for the second School of Gentle session by Johnson's. And all the mommies and daddies out there who have been tuning in or who tuned in yesterday and today as well. Thank you so much. We hope we answered as many questions as possible. And together with Johnson's Baby, we were able to share some valuable information and help ease your worries, even just a little bit. And Doc, apparently, according to my notes here, because
Yeah.
of parent demand, we will have more live sessions with Johnson's in the future. So
Oh,
hopefully we get
coolness.
Yeah, hopefully we get to have a conversation once again and invite even more speakers to talk to the mommies and daddies out there. Thank you so much for your positive response and all the questions. Doc, once again, thank you very much.
And thank you to Katz. Thank you, Johnson and Johnson, and most especially, thank you to the people who tuned in with us. And I hope this was a productive, wonderful night. And take care and be safe.
As what Dr. Dizon said, take care and be safe. Make sure to tune in to Johnson's Baby Facebook page and Instagram for more updates on how to care for your babies and your kids. Again, this has been Kat Salau. Thank you so much. Stay safe, stay healthy, and have a good evening. Bye.
Bye. Thank
Bye,
you.
Doc.
Take care. Have a good night.